Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program provides healthcare professionals, physicians, information about programs we have here at KRMC that will be of interest to you and your family. So I hope you'll stay tuned. We'll be back right after these messages with a great guest. Welcome back to Your Health Matters. My guest today is Denise Casson. He's the Director of Occupational Health on top of many other things, but that's kind of mostly what we'll focus on today.
Okay.
Thanks for being on the show, Denise. Appreciate you making that sacrifice.
It is
I
a
know,
sacrifice.
I know, because you've got so many different hats you wear nowadays. I don't even know how you keep track of them all. But first of all, I want to talk about you a little bit. You've been in Kingman quite a while, right?
Yes.
Did you grow up here?
No, I'm actually from Oregon.
Oh, okay. So when
but
did
I
you
have been
come?
here a long time.
You don't wanna
Longer
get-
than, yeah.
Longer than shorter. Okay.
I came here in 1980.
Okay,
Yeah.
so you've seen a lot of changes
Yes.
in this community.
Huge, yes.
My goodness. How big was it then?
I don't know.
No, a lot
No.
smaller than it is
It was a
now.
lot smaller than it is now.
It was still dirt road out past the hospital.
I know, it was paved when I
was
got
it
here.
by the, oh, okay. Because I
Yeah.
hear stories about how they still have the hitch imposed up by Circle K and
And you know, I don't know how, you know, it was also new to me, but Kingman as a whole, though, was still downtown. There
the main
wasn't,
part, yeah.
There
You
really,
didn't have
all the shopping was downtown.
Okay. All right. Well, so we've grown. That's a good
Yes.
thing.
Yes, that's right.
And you've grown with the hospital because did you come and work at the hospital immediately in 1980?
No, I was still early
Little
years
kid.
of high school, yes.
Oh, okay. You're still a kid. Okay.
Yeah,
Yeah.
uh-huh.
I guess that would. Yeah, that's
Yeah.
right. That you were
Yeah,
pretty
that's
young
quite a
back
while,
then.
yeah. I go.
I remember 1980.
Yes.
Though, that's why I'm
Yes.
like, okay.
Yeah.
Anyway, but so when did you start at Kingman Regional?
I've been at Kingman Regional since 1994.
So you've seen a lot of changes at KRMC
I've
too.
seen huge changes, yes.
So what did you start with?
I started in occupational therapy. That's what actually my degree's in.
Okay.
And then we were based out of the main hospital at that time. And then when the Wellness Center was built, therapy services moved over here. And then since then, I've gotten into more physician services and different specialty offices.
Okay.
And so I really don't have any, I have nothing really to do anymore with therapy. I've just gotten into the management.
So you were actually a therapist. Did you go? So you went to school for
I went
that?
to school at Loma Linda.
Oh, okay. So you
in
left
California.
and came back. Very good. You raised your kids here.
Yep, I
Couple
have two
daughters, right?
daughters. I have a 24 and a 25-year-old.
Very good.
And so
And mom stayed here.
Mom stayed here to support student loans.
Yes, you know what those are.
Yes,
Yep.
that's
Okay.
right.
Well, so occupational health, which is one, as I said, of the many hats you wear, but that's kind of broad. And I know a lot falls underneath that. So let's talk about the different pieces of occupational health.
Well, occupational health is usually what people consider industrial health, or it fits the needs for meeting criteria for OSHA,
Okay, so safety.
DOT,
Okay.
different entities like that.
Okay.
And so we work with individuals, but primarily we work with companies and with federal entities to make sure that everything is being done to meet criteria for whatever industry you're working with or whatever federal mandate there is.
Okay, so you do quite a bit out at the airport, obviously, where a
Yes.
lot of our manufacturing is done here in Kingman.
We provide service to about 300 companies.
Oh, really?
Yeah, we're one of the only true occupational health departments in the tri-state area.
Oh, I did. Oh, so tri-state. This is tri-city.
Tri-state.
So you go to Bullhead and
There
Lake
is not any
Havasu?
true to my knowledge, unless something has come up recently. We're the only true occupational health department that covers all parts. You know, there are some facilities that will do physicals, or there are some facilities that will do PFTs
or
or
drug
drug
testing,
tests,
right.
but we're one of the only ones that covers all aspects.
The whole umbrella of it.
Right.
And now you actually will go out to the plants as well, right?
Right. Yeah, we go on site. We go on site to the mines in the area. We go, you know, we have places that we go that are 100 miles out of our actual area and
not
provide
know that.
service. And we go, like you said, out to the airport, to the different industries. Oftentimes, the employees come to us, but we try to make it as user-friendly as we can to the employers. So, and you know, when you're working in a mine and you're night shift and all these different things, and they may live in Seligman or somewhere else, it's difficult for them to get to us during working hours.
Sure. So when you're talking about OSHA requirements, and that has to do a lot with like work comp, making sure that it's a safe environment, right? So you go in there and help them identify maybe.
Well, there's certain things that you have to do depending on. There's MSHA and OSHA, and OSHA is safety generally. MSHA is mine safety. So we also work with them. We work with the company because those mandates are given to the companies. And then we know what the criteria is, and the company knows what criteria they have to meet to not get fined and to keep their employees safe.
Right.
And so those can be making sure that their employees are in situations that are not too loud, and if they are too loud, that there's hearing conservation things being done to protect their hearing. It can be testing for their breathing capacity, whether or not they're in a situation that they have to wear a respirator. You know, it just kind of depends on which company you're going into on what they need.
Okay. So you kind of go in there, though, and help them identify.
We do identify to some degree, but most of the time they know what criteria they're having to meet.
So you're doing more testing?
We do a lot of testing.
To make sure? Okay.
I do, personally, ergonomics. And sometimes I will go into the companies at their request and look at safety for the sake of their employees and being effective at the same time being safe. So some of that is specific and not having anything to do with OSHA or MSHA or anything else.
Yeah, but it's probably helping if the employee is working in a better work environment, they're going to be more productive.
Right.
Not going to run into carpal tunnel and the shoulder issues and all that if they're sitting correctly or standing on mats type of thing.
Right.
Okay.
Well, you know, oftentimes the employer is interested in it because they're interested in their employees staying safe and being and not being injured in whatever they're doing.
Right.
And they're also interested in preventing injuries for the sake of financial reasons.
Well,
and they're also interested in their employees being on the job. So all those kind of feed into the same thing.
So if someone, we've got an employer out there right now who isn't sure if their work environment's up to par, whatever, they can call you and you can come out and help them.
Yep.
757-2101 and just
ask for occupational health, and then they will contact me, and I will call whoever that person is or entity, and we'll set something up.
Okay. And I know our website, the azkrmc.com, has information about occupational health as well.
Yep.
So you mentioned too that employees can come in. Now, what would they be coming to our facility?
Well, they come for a multitude of things. They can come in for, we do drug testing, and we do DOT drug testing, which is
different,
very specific and regulated by the federal government. There are not a lot of facilities that actually meet criteria to be actually DOT certified to do collections. All of our collectors are certified, and Dr. McGurdy is our physician who is an MRO, medical review officer. He's able to actually look at the results once they come in from the lab and give results to a company. You have to have an MRO, not maybe on site, but you would have to have somebody interpreting
who can
those
read
results.
the test results.
Right, and so we happen to have one here. Most places have to actually send them out to a physician somewhere.
So once again, I always am bragging about KRMC, but the fact that we have someone, again, that's on site that's able to do that, so it's going to give you a faster turnaround time.
Right.
Someone you could call with questions. You know, if you get the results and you're like, what is it? So that's pretty important.
It is a very important thing, especially with the amount of drug abuse.
Right. In Kingman? No.
In general. Yeah. And we do breath alcohol, which is also a requirement, and we do it for companies that are non-DOT. You know, it's becoming a trend, unfortunately, that has to happen where a lot of places are requiring drug testing, and so we can We follow certain criteria when it comes to DOT because they set the rules on how it's done.
Right.
But when it comes to any company or entity, or it's even been individuals before, we follow what they want because they're paying for it.
Right.
So we can specialize it to their needs.
Okay. But I mean, even here at KRMC, all of our employees have to be drug tested before they're offered employment, and then we do random drug
monthly.
testing that just shows, get the call and need to come in right now.
That's right.
And that's a good thing.
Yes, it's a very good thing.
Make sure that employees are safe,
Right.
again, and they're
Right.
working, or if we're here at KRMC, to know that our employees are at their full capacity
Right.
and providing the best possible care for our patients.
Right.
So those things are very important. Then do you do like work comp injuries? Like if someone gets hurt on the job, do they come?
Yep,
to
they
you?
do. And typically, because we are one of the only, if not the only, occupational health departments in the tri-state area, we get pretty much all injuries that are work-related.
Okay.
And so they come in for their assessment. The doctor does the physical, gives his judgment, and then based on that company's protocol, some companies will go with off work, some will go to light duty, and so we kind of follow those guidelines of whatever company we're working with.
And then kind of help get them back to work.
Right.
Right,
And
get
the
them-
thing of it is that we attempt to, and most times are able to, when a new company comes onto service, we go on, do a site visit.
Okay.
Because then we have a better understanding of when the employee says, I'm doing this and it's hurting, or I did this and this is what happened and why I'm here, we actually have an understanding of what they're talking about.
Right.
So we try to be very knowledgeable with the companies that we provide service to.
For 300 companies, that's a lot.
Well, some companies, if they're a manufacturer and we have 4 companies that manufacture the same thing, we're kind of looking at the
Sure,
same type
okay,
of scenario.
yeah, okay.
So we don't have to go to all of those. Or if it's a truck driver, same scenario, unless they're loading or unloading certain materials out of the back, then you'd have to figure that part of it out.
That's good, though, that we have that right here and that it oversees a lot. Now, do you know how many people are in your department? You've got a good
I have
sized
one
staff?
physician,
Right.
and
Dr.
I
McGurty.
have 3 clerical staff,
Okay,
and I have 3 RNs,
okay,
and I have an MA.
okay. So, like, if you do a site visit, when you go out to the site, it's yourself and
Dr. McGurty.
Dr. McGurty goes
Or
with you
I
too?
go by myself, one or the other.
Okay, and you go out there and do that evaluation
And then we
Got
talk
them
to the
started.
employer, find out what their needs are, we try to build a rapport
Good.
and work with them on how we can provide them a service that is helpful to them.
Okay, good.
And
Well, we're going to take a break, and then when we come back, we can talk a little bit more about that and maybe some of the other hats you wear. Okay, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Denise Casson, Director of Occupational Health. We've been talking about a lot of the different things that you can do out at the work site, but you also mentioned doing physicals and PFTs. What's a PFT?
pulmonary function test.
Okay.
And it's a breathing test.
Okay.
For capacity. It might be for somebody who wears a respirator, works in a mine. It could
okay.
be somebody who's a part of a rescue crew on site. We have to make sure they have the capacity to wear the respirator in those situations.
Okay.
We also have to do fittings. Fit testing it's called, but it's a fitting, so we have some companies that are exposed to potentially fatal gases. So we have to make sure that they're wearing the right type of respirators.
That it fits, gives
That
them a
fits
good
well,
fit.
yeah.
Okay.
So
Makes
we
sense.
actually do the testing for them, so then they have that with them on site. They know how to use it, and we know that it works.
Very good.
We do hearing tests. We do vision tests. We do physicals. We
Okay.
do pretty much anything that you can relate to injuries, work-related injuries, and or pre-employment. We do
I was
pre-employment
just gonna
testing.
Yeah, so do some of the businesses have this pre-employment testing so they kind of have a benchmark for the employee? So
Well, what we have done over the years is developed a different physicals for different companies, as related to their demands at that job and based off their job description. So what oftentimes a company will do is they will send us a potential employee, and we will do a physical based on that company's needs. So if they have to stoop, squat, sit, stand, twist, lift, whatever the case is, we're able to determine if that's truly something they're going to be able to do and if it's going to be safe for them.
Okay.
And so that's prior to them actually finishing the employment process.
Well, and that's really important, I would think, from an employer's and an employee's standpoint.
Yes, it is very important, because definitely during the financial times that we've had lately, oftentimes people will put themselves at risk.
Right.
Saying they can do something or hoping they can do it because they desperately need a job.
Right.
And I understand that, but at the same time they are truly putting themselves at risk.
Right, and long-term ramifications isn't going to be worth...
No, right. We do physicals for the Border Patrol too.
Oh.
We do disability for the railroad. We do FAA physicals. We do all kinds of things. In fact, we're on the FAA list at McCarran.
At the airport.
Well, McCarran actually gives private pilots our information, because we're one of the few people in the area. In fact, most people, if they don't come here, they go to Prescott, because there's so few people that do FAA physicals.
Oh, wow. All these little feathers that you guys should, or badges of honor, important things you can do. That's really awesome.
We provide a lot of services. We really do.
I don't know that most people probably don't even realize that's all here, or those services are available. So that's really good. So we have to put posters up at the airport or something. Yeah. Make sure all the pilots
most everyone's aware at the airport here. Yeah.
Okay.
Because it's the private pilot's license that we do, not commercial.
Right, right. But we have a lot of private pilots that fly.
Yes, we do. We also do immunizations that most places don't provide, whether it be industrial or not. We do a lot of immunizations for tri-state area for yellow fever for international travels.
I was just going to say, so you're talking about not just measles, mumps, and chickenpox. You're talking about more the serious ones if they're traveling to other countries that they need.
So we help them based on the CDC recommendations.
CDC.
Center for Disease Control. Okay. We help them determine what they're going to need to travel to these countries and what would be in their best interest to receive.
So you can look it up and, you're going to...
Well, a lot of these countries, when you cross into their country, they will look that you've had those before you are allowed in anyway. So we try to help them get whatever they need.
That's good. Well, in fact, I think I remember our Live Now team that was going to Africa, and the first group, when the first time they went, and they were all walking around with
Yes, that's right.
because they had to have such a battery of immunizations before they
huge.
went over there to Africa. So they got all of that in-house from our own OCHealth. Okay, so we talked about OCHealth, but I know that there's a bunch of other hats that you wear. Mostly you're working with a lot of our physicians now.
Yes, right.
And which groups report to you, or do you support?
I have urgent cares fast tracks at both the Golden Valley and Stockton Hill, obviously. And I have Morgan Family Practice, which is Dr. Morgan, based out of Golden Valley's fast track site. I have Dr. Kevin Brown with Kingman Family Practice, which is here in the professional building. I have Dr. McElhaney and his orthopedics. I have Dr. Ferrari and Dr. Allen, which are also orthopedics. I have immunology, which is Dr. Asokan, who is one of our physicians on site.
Right.
I have Dr. Jakulukan, who is our infectious disease doctor. I have Dr. Otero, which is our gastroenterologist here on site. I have employee health, which is a part of occupational health. Okay. And then I have anesthesiology within the hospital.
Oh, I didn't know anesthesiology. Not too important. You don't have any dull minutes, do you? No.
And I don't know. I have more, and I feel bad because now I've just gone blank.
I put you on the spot.
Yeah, that's okay.
As we're talking, if they come to you, you can spit it out later.
Okay.
But all of those...
Well, I have psychiatry, too.
Oh, psychiatry. That's right. We have a new part-time psychiatrist.
Yes, Dr. Shift and Dr. Zagara.
That's awesome, because that's been
another
another
gap.
gap.
And they're on call for inpatient, yes.
Yeah, been a big gap in our providers, so that's important that we've been able to add them. So when I say you're the support for them, you actually all of their, or not all maybe, but the majority of their office staff you're responsible for, right? Do you
All.
do the all? Okay, I wasn't sure about
Yeah.
like Dr. Sokin. If okay, so we do all of their medical staff, which to me has always seemed like a great benefit for the physicians because
It is. It's helpful because a lot of private practice physicians that are not employed per se by Kingman Regional Medical Center would do not have the means nor the time to hire support and do things like benefits and all those different things.
Sure.
So we provide a service where we do that for them.
Yeah.
And
Well, I always said that docs, when they go to school, I mean, get 8 years of medical school and then 4 years or more after that, but I don't think anywhere along that line does any class teach them how to run a business.
right.
And so for us to be able to provide them that service, to run the practice for them, number one, it allows them to focus on what they went to school for.
Right.
To provide the very best patient care.
Right.
And we take care of the headaches that go along behind. And
Right,
I
we
know
try.
there's lots of headaches behind that.
I try, yes.
But that's a big job.
Well, it is
especially for
true.
that.
You know, physicians, they went to school to become a doctor. They did
Right.
not go to school to become a counselor or an HR person
Right,
or
or
any of
office
those
manager,
things, office
billing
manager, billing.
Yeah.
And so there has to be the support for them in order for them to provide the service that they are attempting to provide. So support staff is huge, and whether it be one that we're managing for them or just in general, you know, it is truly a team effort. And so for us to have the best support staff and provide the service to the patient and provide the service to the doctor is kind of a win-win for everybody.
Yeah, that is amazing. So how many, I'm put you on the spot, maybe just approximate employees do you think you oversee?
Probably 90.
I was going to say 60 or 100, somewhere in between there, I bet. Yeah, that's a lot. And that's just one piece. I don't think sometimes that people realize that KRMC is the largest employer in Mojave County.
Yes.
We're over 1,600 employees now, so that's a lot of jobs
Yes,
that
it
we've
is.
created
Right.
for our
It is.
community here on an ongoing basis. So
Right.
that's pretty huge.
It is.
And that's a lot of employees to be drug testing and doing
That's
drug
right.
testing for
It is
too.
true.
That's a big
That's
piece
right.
of it. Well, and I know when, as a new employee, it's been a few years now for me, but that we get that pre-physical, we have to do a background check, we do that drug testing and make sure all of our immunizations are up to date, and
Right.
all of that was done through
Right.
Occ Health.
Right.
Just for KRMC on top of what
Yeah,
you do
and
out
that's the
there.
employee health portion.
Okay,
But
so
we
that's
do.
what you're talking about.
We consider Kingman Regional Medical Center as one of our companies that we
Clients, okay.
provide service to.
Okay.
We provide that same service to others, and of course, because we are part of KRMC, we strive to make that service, you know, the most easy access and that kind of thing, because we're on site. Well,
Right.
we're on Sycamore now, but
I was just going to say, I know we should maybe share with people that your offices have moved. You're over in the
surgery,
Doctor
what was surgery center, right?
on Sycamore there, kind
Right.
of behind kitty corner from the hospital.
Right, across from Mojave Mental Health.
Right, okay.
Right.
So you've got new facilities there, but they can still reach you by calling the 757-2101.
Yes, or they can call 757-0613.
0613. Okay.
Either one.
Very
We'll
good.
get it.
All right. Well, Denise, thanks for being on the show today. I learned something new again, and it's always good to have you on the program.
Thank you.
Thanks. I hope you enjoyed the show today, learned something new like I did, and you'll join us again next week when I'll have another exciting guest.